when you look at how much money can be made from these moments, unprecedented amounts of money, and we're talking, probably, billions definitely, but maybe even trillions. And there's mandated things that everyone now has to do, like a vaccine. And there's no repercussions for the people making a vaccine, and they still get to make all the money, and the government funds the production of it. Now, again, I understand this was unprecedented. So the pursuit to get a vaccine seemed like, okay, that seems like a logical thing. I mean, I was like, yeah, we need to get that thing rolling, in the beginning. But as you start to unpack it, you're like, man, did we just all get played? You know what I mean? And then there's a second one, and then there's a third one. And like my doc, and this is, this could be total coincidence, but my dad went and got his booster. Like, this was like 3 months ago, which I'm like, Dad, why are you getting like your fifth booster? Like, relax. He went into AFib 2 days later, and my dad's worked out 5 days a week, basically his entire life. He's 71 now, super healthy, has never had health issues. He gets like his fifth booster, and 2 days later he goes into AFib. They had to like shove this thing into his heart and like shock it to get it back. And so then it's like, again, am I skeptical a little bit? Could that have not been causation, just correlation? Maybe. But also, could that have been immediately linked to it? Maybe. So I don't know, Doc, kind of loaded, but how the heck did we get to the point where real science is getting rejected, and we're using fear to trump that?
First of all, I just want to validate how crazy that was. I think that was like, we're all like, I think one day we'll look at this from bird's eye view and be like, what the actual F? Like, it was crazy. Like the lack of being able to communicate and have a contrarian viewpoint. It was nuts. Like, one thing, I'll give you an example. Like, one thing that I could not say back in the day but I would say comfortably now is the urgency to booster, for example, children. Like, that to me, it got crazy. Like, you're basically looking at studies at the time, like there's the different safety profile for some of these, but you got 2,000 kids that you vaccinate, and you'll be like, okay, you're good to go with a low risk group. And then you're hearing about the myocarditis for males, especially the 18 or 16 to 29-ish, like seeing that and being at risk of being canceled just for mentioning myocarditis. It got so crazy. And like, let's be honest, every medication has risks, okay? And you're right to say that at the beginning, yeah, we're all, give me my vaccine or what have you. But as the virus mutated into something less deadly, I'm like, folks, the urgency is not there. And so there's nothing wrong with asking about that risk reward. Like, there's a bunch of posts with autoimmune diseases that it's going to be exacerbated potentially by getting that booster or whatever. And people that are wanting to actually be wise and do a cost benefit analysis for a treatment are getting canceled or shamed. And it's like, it doesn't make sense. And you know what else? I'm just getting a little testy here, but what pissed me off, okay, was, from my perspective, I'm just going to paint a picture of our life when we were getting bombarded with COVID patients, right? I'm sleeping at the hospital, like doing 30-something hour shifts, seeing people die and go through agony, and seeing a burnt out staff, and it was heart-wrenching. And so I did not want to see any more people get sick and die of COVID. But do I think people should have autonomy? Do I think people should be able to make decisions for themselves? Absolutely. Where are we living? Like, should people have the right to ask questions about what they're receiving? Why not? We're in North America. And so if I'm saying this as a person that their life gets miserable if we get inundated with COVID patients, why am I the unicorn? Like the white unicorn. What? Like, why? Like, it doesn't make sense. Like, it was so baffling, and it to the point where it just pissed me off, where all these online Muppets were just like attacking you, saying like, oh yeah, you want to be busier, you want to make more money. I don't want to see another COVID patient. I don't even want to bring it up. But people should have the right to question. People should have the right to look at the data and say, hey, my 22-year-old shouldn't get a third dose because I'm hearing about myocarditis. And if they, even though it's relatively rare, but if my kid is an athlete and now is out of commission for not 3 to 6 months because of this, I think that's a reasonable thing to be able to ask. I mean, come on, man, it's crazy. Sorry, I get a little bit jazzed up about it just because it's like we just lost our minds.
Well,
We lost them.
I think what's so cool for me, and I think Bear would agree with this, is like us dum-dums, saying Bear and I, like, we talk about this thing, but we're not a doctor and we weren't in an ICU seeing it firsthand. So to hear your perspective on it and to see that there is a resonance between kind of what we were feeling as the everyday person and then what you were feeling as somebody actually seeing it is really encouraging. And of course, I've heard, and I know Bear has too, you hear other doctors who kind of went through something somewhat similar to you, which is just good, because it is like, even I know myself and my fiance, like, there were friendships, there were family members that were mad at us because we weren't making the same decisions they were. And of course, we were never trying to puke our viewpoints onto them, but it's going to come up in some one way or another, even if it's just like getting together or going outside together. As you mentioned earlier, like, we were willing to do those things, but we were almost outcast by certain individuals.